Morning. Welcome to Coffee with Chime. I'm Leslie Krigstein.
I'm Jake Glancy.
We are two of the three members of the Chime public policy team. It is a pretty crazy time here.
And appropriation seasons, nothing is more crazy than Washington, D.C. right now.
Yeah, between the 1,000 pages of rules that have come out from ONC and CMS in recent months, as well as a lot of activity on Capitol Hill relative to cybersecurity and interoperability. There really hasn't been a shortage of excitement here in our world. On the congressional side of the House, we actually are submitting a response to Senator Mark Warner. He had put out an RFI on healthcare cybersecurity. So CHIME and AHIS jointly this morning submitted a response outlining how we think policy could help our members and the broader healthcare community improve their cybersecurity stature. And, I guess on the federal side this week, we also submitted a response on cybersecurity, this time to the FDA, on their pre-market cybersecurity guidance. So cyber is front of mind for our members. It is also continuing to be front of mind for policymakers, and we do not expect that to change. So some good things in the works, and even one of the other big things that in our world has come out in the last few weeks was the president's budget.
Mm-hmm.
So along the lines of our response to the FDA, in the FDA budget that was released this week for fiscal year 2020, that is, the FDA actually clarified that they need some additional authority to pursue more stringent cybersecurity regulations, not just guidance for the medical device industry, which is something that the CHIME family of organizations has really struggled with and continue to raise our concerns on. So that was an interesting fact in the budget.
Really good to see that they're taking initiative on this and really trying to push the cybersecurity manufacturing side. A long time coming for Leslie and Marley. I'm new here, so the first few months of the fireworks happening, it's a great thing to see and to keep continuing working on with the FDA.
Yeah, and the other piece of the president's budget, which of course, the president and the administration submit their budgets, and then Congress kind of does what they want relative to funding. So, watching what happens with the Labor, Health and Human Services subcommittees on both the House and Senate sides, the budget did propose a cut to the Office of the National Coordinator. So that's something we'll be interested to follow. Not as big of a cut as had been previously requested in prior years, but still something like, I think, 27%. So pretty substantial. But, that's a big piece of conversation across our world. There were some other, IT pieces that we'll continue to track and watch the appropriations process as it progresses. I think there's some optimism that it will move faster this year than it has in past years in an effort to maybe evade the need for a continuing resolution, which often puts a lot of chaos into the federal government to avoid shutdowns. But Jake, one of the other things I think we should definitely highlight for folks joining us is, not only did the administration and ONC and CMS say, hey, it's time to look at interoperability and resulting from the 21st Century Cures Act with the information blocking rule, as well as CMS's patient access and information interoperability rule. Next week, the Senate Health Committee, chaired by Senator Lamar Alexander from Texas, is hosting a hearing on those rules. So we're expecting provider perspectives, payer perspectives, EHR developer and app developer perspectives to be offered during this hearing next week as they dig into the nearly 1,000 pages of rules. So I know on the CHIME side, we've had, I think, something like 8 work groups.
So I think 9 more coming soon.
Exactly. So, in addition to being able to summarize some of the big policy pieces that have either come from the administration or Capitol Hill, we are always looking for engagement with our members, with our foundation firms, to make sure that we are sharing, our perspectives and our expertise with policymakers. So there are ample opportunities for you to get involved in public policy activities. As we were saying in jest, but in all reality, these interoperability rules are really going to have a great impact on the CHIME family and all of our organizations. So we have had a number of work groups. There are a number also scheduled for the remainder of March and into April. The comments for those rules aren't due until May, but as you can tell, given the volume of work groups, there really is a lot in there that we're trying to unpack and make sense of. So we would welcome your participation. Please reach out to policy@chimecentral.org if you'd like to join one of our work groups. And on the congressional side, we're going to announce a new work group on Monday, and that is in response to a congressional inquiry on telehealth. So in the past, there's been bipartisan interest and bicameral interest in looking at telehealth expansion. And so we were fortunate to receive a letter from a really impressive group of House and Senate members last week. And there's a quick turnaround of April 1st. Exactly. So if anyone in the CHIME family, again, members of AHIS, and AHIA, members of the CHIME Foundation, we would love your perspective on what some of those policies in the telehealth space that Congress should look at, whether it's expanding reimbursement, ways to expand access, particularly in rural and underserved areas, and some of the promising technologies that maybe Congress needs to be accounting for as we're moving forward.
And also on that too, a lot of things moving on Capitol Hill is costs. How can help with healthcare costs across the board? Please let us know about that. One word just seems to get everyone buzzing around healthcare in this town, and it's costs.
Exactly. And then, one of the kind of last things I think we are all very acutely aware of, but 2019 has quickly become, the year of privacy on Capitol Hill. We are seeing hearing after hearing.
Everywhere.
Exactly. House, Senate, just about every congressional committee has jurisdiction over privacy. We're seeing the tech giants, hauled before Congress and ask them pretty difficult questions. And so what we're trying to do on the CHIME side is work both with the regulators on making sure our members are in the know on what their expectations are given current either OCR or FTC guidance. But moreover, as some of the legislative conversations progress, we're really trying to find where the boundary is of HIPAA and then consumer protection rules from the FTC, especially as we're seeing this blurring of the lines between what has traditionally been healthcare data, and then as that, once HIPAA-covered healthcare data is entering the app world, making sure there are good consumer protections in place, and patients and consumers are aware that their data may be leaving the HIPAA world. So that's definitely something that we're keeping a watchful eye on. And again, if anyone in the CHIME family has thoughts on how we can really inform policymakers and weigh in on those privacy conversations, we would welcome to the opportunity to talk with you and to hear your perspective. We touched briefly on cybersecurity and some of the activity that we've had this week, but even folks thinking through how can we avoid the next big event. And unfortunately, so often we hear it's not a matter of if, it's when. And so our comments, both back to the FDA as well as to Senator Warner, addressed making sure that we can shore up medical device cybersecurity. So Senator Warner asked about the prevalence of end-of-life software in operating systems that are used by medical devices and other technologies in healthcare, and what we can do to try to either phase them out or make sure that they're as secure as they can be. To the FDA, we highlighted the need for a more proactive state. So I think the fact that we're willing to, or that policymakers are willing to be more proactive in considering these issues is really important. And as well as, continued conversations with OCR and with NIST on how we can make sure that the frameworks that NIST is developing, the very popular cybersecurity framework, as well as the expectations from OCR under HIPAA, making sure that those align with cybersecurity best practices, and really aren't just a compliance focused effort, but we are really looking at risk, I think is where that conversation is headed. And hopefully, if we can get more resources to our members, if we can better educate providers and patients as well, hopefully we can mitigate some of the threats that, of course, unfortunately, are likely to hit our members and their organizations. But I think one thing before we wrap up, Jake, that we need to flag for folks is we are really excited about having another advocacy summit. So some of you may have joined us or may be aware that in 2018, CHIME launched our first ever policy-focused conference. It was right down the street from Capitol Hill. And we're having another one this June, so June 26th through 28th. Please consider joining us in Washington. We have a really impressive lineup of speakers, some headliners from Capitol Hill. So Congressman Bill Johnson, who was actually formerly a CIO before he came to Congress, he's going to share some background on his experience and how that has enabled him to be an effective policymaker. We yesterday heard that Kim Brandt, who has a very impressive resume, spending a lot of time on Capitol Hill and is now a very senior official in the administration leading some of their regulatory reform efforts. She's going to be able to join us, as well as Will Smart, who's the CIO of the NHS. He's going to give us an update on compliance with GDPR and also give us some feedback on his experience. Because as we are also aware, WannaCry really hit the NHS hard. So, how did they learn from that experience and how are they moving forward to solidify their cybersecurity posture? We have senior officials from OMC. Dr. Rucker is going to be joining us again. Some of the other senior leaders from the standards, policy, and medical divisions within OMC are confirmed, as well as speakers from the FTC and NIST. So we're really excited. We think we've got a really robust program, lots of opportunities for engagement, and for those CIOs and CTOs and CAOs and CISOs who are coming to town, we also will look to bring you to Capitol Hill to meet with your members and their staffs as well on some of the issues that are near and dear to your heart. So please consider coming to Washington and joining us. It really has the promise of being a great event, and hope to see you here. I don't know, Jake, shall we wrap it up?
I think it's time to wrap it up.
I think we're, excited that it's Friday, but the action really doesn't stop here in Washington. So please consider reaching out to us. We love to hear from you. We love to interact with the members of the CHIME family, the CHIME Foundation. You can always reach us at policy@chimecentral.org with any of your questions, comments. We love to hear from you. So happy Friday. Everyone have a great weekend, and we will talk to you soon.
Talk to you later.
Bye-bye.